Often with distal radius fractures, we can get your wrist moving within the week of surgery to minimize stiffness and to maximize function. I enjoy fractures. I enjoy injuries. As an orthopedic surgeon, we see many injuries, and as a hand surgeon, I see lots of injuries. I had the privilege of working at Harborview here locally to deal with some of the worst injuries around. I also had the privilege of working at Harvard at Mass General Hospital and their pediatric hospitals to learn a wide variety of all injuries, not just hand. One example of a fracture that I see a lot of is a wrist fracture. People fall and put their arm out, and we call it a fall and outstretched hand. And a distal radius fracture is the most common type of fracture, but there's many other fractures from the collarbone all the way down to the fingertip that I love to treat. Many fractures come through the emergency room, but many come and call me after they've been to a different emergency room and are interested in care, and I'm always happy to provide that. The most common wrist fracture is what we call a distal radius fracture, and as you may or may not know, there are two bones in the wrist. The bigger one at the wrist is called the radius, and the smaller one is the ulna, and the radius breaks a lot. At the elbow, the ulna is the biggest, and the radius is smaller, and the things are quite reversed there. But at the wrist, broken distal radius affects the most important functions of the wrist and hand. So it needs to heal well, and unfortunately it doesn't always heal well. Most patients don't need to be told they have a wrist fracture. They usually have a pretty good idea something really bad just happened, but you certainly need an x-ray to sort it out, and you don't always have to go to an emergency room to get that diagnosed. We're happy here to see you even on an emergency basis to sort out most injuries of the wrist, hand, elbow, and shoulder. So you're wondering if you broke your wrist. You had a fall and your wrist is swollen and it doesn't move well. Often, especially in children, that's a break. Children rarely sprain their wrist. It's almost always broken if it hurts significantly, especially if you go to sleep and wake up the next day with a sore wrist. I'm always happy to see anyone just to check and make sure it's not broken, but often in kids it is. In adults, sometimes you can get a sprain, but lots of swelling usually means a break. And often in the wrist, because of the importance of it, we need to diagnose it fairly quickly and treat it fairly quickly to get it fixed the way I would want it fixed. So you have a swollen wrist and you're worried that it might be broken. I would recommend giving us a call. We can usually get you in that day, or if worst case scenario, maybe the next day. And we'll make a diagnosis based usually on x-ray and clinical exam and hearing your story. And if it is broken, then often we'll give you some pain medication, some splinting to get over the worst of that day's conditions. And then we'll have to make a decision on whether the fracture can heal on its own with a cast or whether it needs surgery. A cast these days we can make waterproof, which often makes the process of getting through the wrist fracture much more convenient. And especially in children over the summer, a waterproof cast is a lifesaver. There are a few conditions where waterproof casting isn't an option, and that's usually when there's a wound associated with it or a surgery associated that we need to keep an eye on. Some fractures, though, won't heal just with a cast alone, and there's pieces out of place that will, though they heal in the wrong place, and you'll get arthritis or loss of function pretty quickly. And in those cases, we'll undergo what's called a open reduction and internal fixation or surgery for your broken wrist. And that's where I make an incision in your wrist, put the bones back where they started, stabilize it, usually with plates and screws, and often with distal radius fractures, we can get your wrist moving within the week of surgery to minimize stiffness and to maximize function. One thing to note about x-rays for wrist fractures, sometimes x-rays don't show us everything we need to see to get you to where you want to be. Some fractures are just broken into so many pieces that we need to get what's called a CT scan to help delineate where are the fractures and plan for our surgical planning. So that's another test you may get. In addition, often bony injuries have significant soft tissue injuries that we can't diagnose either on x-ray or on clinical exam because it hurts so much. In that case, an MRI is an invaluable tool and can delineate most other injuries, and usually we can coordinate soft tissue healing with the bony healing if we know what it is, and that's where MRI is important. Occasionally, another study we may order is electrical study, where we have to investigate the status of the nerves in the wrist and hand. You can think of electrical study on the upper extremity as an EKG, but for the arm, where we're testing electrical conduction along with soft tissue with the MRI and the X-ray for the bone. If a fracture is small enough and can be fixed with casting, typically 6 weeks in a cast is common. One of the neat parts about surgical fixation is that if you unfortunately do need a surgery, often because the plate is much stronger than our casts, I can get you moving much faster after surgery. So fractures of the distal radius, a common injury that needs surgery, usually by 1 week, you're moving your wrist, you're able to lift a cup of coffee, you're able to type, you're able to get some work done. Maybe over 5 pounds, we hold off for about 6 weeks. After 6 weeks, if the bone is doing well on x-ray and on exam, then usually I can have you lift everything by 6 weeks. And so often my patients who need surgery are well ahead of the patients that didn't need any surgery due to the lack of casting and immobilization.